Now talking about the several questions that are asked from larynx topic, right? From what? From larynx topic. Larynx topic in ENT. Okay, now before moving into the specific topic asked from larynx, specific question asked from larynx, let us understand the brief anatomy about larynx. We need to know about this epiglottis, the bone that is situated below our hyoid bone, right? Similarly, what is this? This is our thyroid cartilage. This is our thyroid cartilage. We need to know about it also. And below, what we have is we have cricoid cartilage. Okay, cricoid cartilage. Now this between this hyoid bone and thyroid cartilage, what we have thyrohyoid membrane. Similarly, between cricoid cartilage and thyroid cartilage, where cricothyroid membrane, and below cricoid cartilage there is what? There is our trachea. I mean, below its level there is trachea, and between trachea and cricoid cartilage there is cricotracheal membrane. So these are important landmarks. Now moving to our specific question, the first question that we are going to look, which is asked in several times in KU exam, is what are the different intrinsic muscle of larynx and their knob supply and function. Now different intrinsic muscle with their what? With their knob supply and their function. Okay, now before getting into this question, what is intrinsic muscle and what is extrinsic muscle? Intrinsic muscle are those muscle, right, which act within larynx between their cartilages. I mean, which attach laryngeal cartilages to one another. Those are our intrinsic muscle. And talking about extrinsic muscle, what they do is they are muscle which attach larynx to surrounding structure of larynx. Now talking about intrinsic muscle, I've already said they act within the larynx and they help to connect, they help to attach laryngeal cartilage to one another. And these what? They act on vocal cord and laryngeal inlet. Now these are divided in such a way that one is the group of muscle that act on vocal cord and another is the one that will act on laryngeal inlet. Now talking about the one acting on vocal cord. Now the one acting on vocal cord, what are these? These are divided into the functions they perform, such as the abductor, adductor and tensor. Talking about abductor, there is only one muscle that helps in abduction, right? Abduction of vocal cord. And what is that? That is posterior cricoarytenoid, and it is several times asked in MCQ also, so it is worth to memorize, right? What is this? This is posterior cricoarytenoid. Okay, now talking about the adductor. What are the adductors of vocal cord? These are what? The posterior cricoarytenoid we kept in it is in what? Abductor. Now similarly the lateral cricoarytenoid, it is the adductor, right? Lateral cricoarytenoid is the adductor. Similarly two arytenoid, one is interarytenoid and another is thyroarytenoid, right? Two arytenoid are the adductor. Similarly the tensors are what? Cricothyroid. It is also several times it is asked which is the following is tensor of vocal cord, and we need to take what? Cricothyroid. Similarly, yeah, cricothyroid is what? Cricothyroid, and another is what? Vocalis, the interior part of thyroarytenoid. Now these were the muscle acting on vocal cord. I think we're clear now. The abductor, adductor and tensor. Tensor is cricothyroid, right? Vocalis, the internal part of thyroarytenoid. Similarly the adductor was what? Our lateral cricoarytenoid, and what? Another two arytenoid, interarytenoid and thyroarytenoid. Similarly the abductor, only one muscle, that is posterior cricoarytenoid, as we are clear about what? And the muscles acting on vocal cord. Similarly the muscle acting on laryngeal inlet, right? It is also divided on the basis of function. What is going on laryngeal inlet? One is the opener of laryngeal inlet and another is the closure of laryngeal inlet. And talking about the opener of laryngeal inlet, okay, talking about the opener of laryngeal inlet, what we have? We had thyroepiglottic. What? We have thyroepiglottic. It is also several times asked in our what? MCQ. Thyroepiglottic. Okay, and the closure of laryngeal inlet, that is interarytenoid, right? Interarytenoid, it was also the what? It was also the abductor, right? Adductor. Okay, these are the several muscles, intrinsic muscle, which were acting on vocal cord, right? So vocal cord and laryngeal inlet. Overall we can say these were overall intrinsic muscle with their functions. We also already talked about the functions. Now in question there was what? There was the sensory there was what? The knob supply. The question in question there was what? There was our knob supply and function. Function we already mentioned, and talking about knob supply, we have motor supply and we have sensory supply. Talking about motor supply, all the muscle which move vocal cord, right, either they are abductor, adductor or tensor, are supplied by what? Are supplied by our recurrent laryngeal nerve, right? Recurrent laryngeal nerve, except for cricothyroid muscle. We know what are these cricothyroid? These were the tensors, right? Tensors of vocal cord. So cricothyroid are not supplied by our this recurrent laryngeal nerve, and these cricothyroid, they are supplied by what? Our external laryngeal nerve. Okay, I think we're clear now. Cricoid are supplied by external laryngeal nerve, which is a branch of superior laryngeal nerve. Okay, now moving further, talking about sensory supply. Now sensory supply, what we have is above the vocal cord, right? Above the vocal cord, larynx is supplied by internal laryngeal nerve, right? Above the vocal cord, it is supplied by what? Internal laryngeal nerve, a branch of superior, and below the vocal cord by recurrent laryngeal nerve. Now sensory supply, it is by two nerve. What are the two nerve? One is internal, one is what? One is our internal laryngeal nerve, which is the branch of superior laryngeal nerve, and another is, we can simply memorize it as what? Superior laryngeal nerve and recurrent laryngeal nerve. Recurrent laryngeal nerve below the vocal cord, right? And superior laryngeal nerve, as name suggests, what? Above the vocal cord by superior laryngeal nerve. I think we are clear now, right? Okay, these were the motor and sensory supply of our intrinsic muscle. Okay, if again motor, it is supplied by what? All the muscles of vocal cord, right? They are supplied by recurrent laryngeal nerve, except for our cricothyroid, which is external laryngeal nerve or superior laryngeal nerve. And talking about sensory supply, it is divided into above the vocal cord and below the vocal cord. Above the vocal cord, it is supplied by superior laryngeal, and below the vocal cord, it is supplied by recurrent laryngeal nerve. I think we are clear about it. Now moving toward the next question. The next question is very popular, and it asks about what? Mention the subdivision of larynx, right? And or mention site and subsite of larynx. This is several times asked. And talking about site and subsite of larynx, okay, the first thing is we need to know about this diagram. Now here in this diagram, the larynx divided into what? Three division. What are the three division? The three division are, as you can see, what is this? Glottis, one is supraglottis above one and subglottis below one. As you can see, this is what? This is our what? Site of larynx. Now glottis, right? Now talking about specifically about glottis, supraglottis and subglottis, as you can see, glottis, right? True vocal cord including anterior and posterior commissure are included within it, right? Now glottis is a site, and within this site, what are present within our this glottis? Within this glottis, as you can see, what? True vocal cord along with anterior and posterior commissure are present within our this glottis. Okay, we are clear. Now talking about what? Supraglottis and subglottis. Now supraglottis, right? Supraglottis, what is present there in supraglottis? Suprahyoid epiglottis is present there, right? Okay, the one is suprahyoid, right? Another is our infrahyoid, right? Okay, now what? Another is ariepiglottic, arytenoid, and ventricular band, or it is also called false cords, right? False cords. So true vocal cord, it is present in glottis, whereas false cord or ventricular band, these are present in supraglottis. So we are clear about what? Supraglottis and glottis. Supraglottis, what is present there? Two hyoids, one is suprahyoid and another is infrahyoid, right? Okay, and two is, what are these? Ariepiglottic and arytenoid. Ariepiglottic and arytenoid. And similarly, another our false cord, or that is also called ventricular bands. Okay, talking about what? Glottis, true vocal cord including anterior and posterior commissures, we already mentioned about it. And subglottis, what? It is up to lower border of cricoid cartilage. That means cricoid cartilage is present within it, right? Okay, now we are about what? We are we have already talked about classification of site on various subsites, and one important question that is often asked is about what, about different site and diagnosis, prognosis within different site. It's asked about what, the cancer within different region of larynx, right? The glottic cancer, supraglottic cancer, and subglottic cancer. And it often asks about what, the prognosis. What are the prognosis, where the prognosis is very much nice, or where the prognosis is not that much nice. Okay, talking about the prognostic factor, the glottic carcinoma, right? The cancer within this glottic region is better than of other sites. Now why is it so, right? Because if there is glottic carcinoma, right, if there is glottic carcinoma, since true vocal cord is present right here, what will happen is that hoarseness of voice will be the earliest manifestation, right? The patient will present with hoarseness of voice, right? And another is, as the hoarseness of voice is seen, the patient immediately visits the physician, and he can get the immediate treatment. And one is this reason, and another is there is no nodal metastasis in glottic carcinoma, right? Now why there is no nodal metastasis in the case of glottic carcinoma is that in glottic carcinoma there are no lymphatic, right? There are no lymphatic in vocal cord, we can say. However, after having spread to surrounding tissue, nodal metastasis may occur, but the chances are less since vocal cord do not contain our lymphatic. So we talked about what? We already talked about the prognostic factor, right? Prognosis is better in glottis since the patient presents with hoarseness of voice, the earliest manifestation. And also we talked about what, in glottic there is vocal cord, and vocal cord do not contain what, lymphatic. Since it do not contain lymphatic, there is no less chances of nodal metastasis. So the prognosis of glottic carcinoma is better. So this is one question that is asked, right? Often asked. Okay, we have done with two questions, right? One is the muscles, another is what, our this subsides of our this larynx. Now moving further, what we have another question is, okay, let me see. We have, okay, there is one important question that is also often added as tail question in maximum questions. What is Ranke space, where it is localized, right? Where it is localized. And talking about Ranke space, it is, as you can see, Ranke space is under epithelium. As you can see, what is this? This is epithelium, right? We can see this is epithelium of vocal cord. Now under this epithelium of vocal cord, right, there is potential space with scanty soft epithelial connecting tissues, right? Now, and it is bounded above and below by arcuate line, in front by anterior commissure, and behind by vocal process of arytenoid, right? Okay, what I'm saying is there is one potential space between below this epithelium of vocal cord, this potential space with scanty soft epithelial connecting tissue, right? This is what this our Ranke space, it is what it is filled with scanty, right? Scanty connecting tissue, soft epithelial connecting tissue, right? As you can see, lamina propria, right? And it is, okay, we talked about what is this. It is the potential space between below epithelium of vocal cord, right, with scanty subepithelial connecting tissue. And talking about its location, where it is bounded above and below by arcuate line. Okay, it is bounded above and below by arcuate line, in front by anterior commissures, and behind by vocal process of arytenoid, right? Anteriorly it is bounded by our anterior commissure, and posteriorly by vocal process of arytenoid. I think we're clear with it. Okay, and now edema within this space causes what, fusiform swelling of membranous cord, and that is our Ranke's edema. And this is also one of the most popular question. So we are clear about Ranke's space, right? Now moving further, another question that we need to talk about is about stridor. Now talking about stridor, okay, the question that is often asked about stridor is, let me see question directly to you, and it's asked about what are what is stridor and enumerate the causes of stridor. How will you manage the case of stridor in an elderly presenting patient having carcinoma of larynx? So okay, the question is what is stridor, what are its causes, right, and how you are going to manage it. So let us talk here about stridor. Now before getting into stridor, there is one popular question that is often asked: the difference between stridor and stridor. What is another? STERTER, stridor. Okay, stridor and stridor. Now simply this stridor, what is stridor? Stridor is heavy snoring. What it is? Heavy snoring, inspiratory sound, right, which occur when the person is in coma, deep sleep, or sometimes due to obstruction of larynx or upper waist. What is this? This is our heavy snoring inspiratory sound, right, that often occurs when the person is in deep sleep or coma, or when there is obstruction in upper respiratory airways. Now simply now another, the stridor. What is this? This is defined as high pitched noisy sound, right? It is what it is, high pitched noisy sound, and that occurs during inhalation or exhalation. In stridor we are talking about, it occurs in inspiration, right, during inspiration, but our stridor, it occurs what, it is noisy respiratory sound that occurs during inspiration or exhalation on any time, right, and it is a sign of what, respiratory obstruction. So these are the two differences, and the most common cause is mainly because of croup, foreign body, bacteria, tracheitis, pharyngitis, right, pharyngeal abscess. These are the main cause. But the above one or the stridor one which we are talking, these are what these are the main cause of these include choanal artery, choanal stenosis, enlarged tonsil, adenoid, redundant upper airway tissues, right. It talks especially about upper airway tissues. Okay, now talking in detail about stridor. Now what is this? This is noisy respiration produced by turbulent airflow through narrow air passes, right, and it may be hot during inspiration, expiration, or both, as we have already said. And stridor, it was what, it was mainly hot during what, inspiration. Okay, inspiration. Okay, stridor, define stridor. We have already came on the definition of stridor, that it is what, noisy respiration produced by turbulent airflow. Noisy respiration produced by turbulent airflow through when the air passes through narrow air passes. It may be hot during inspiration, expiration, or during both. Now talking about the type of stridor: inspiratory stridor, expiratory stridor, and biphagic stridor. Okay, talking about inspiratory stridor, it is often produced in obstruction, such as in lesion of supraglottic or pharynx, right, supraglottic or pharynx. As you can see, in pharynx or supraglottis, if there is obstruction in this region, pharynx or supraglottis, right, for example laryngomalacia or retropharyngeal abscess, laryngomalacia and what, our retropharyngeal abscess, if there are obstruction within this region, then that we call inspiratory stridor. Similarly, talking about what, biphagic, if there is obstruction or lesion in glottic, I mean below the structure of what, supraglottic, obviously there is glottic, right, subglottic, and cervical trachea, right, cervical trachea. Now if there are obstruction within these region, glottis, subglottis, and cervical trachea, then there will be biphagic stridor, right, lesion in glottic, subglottic, and cervical trachea. And these, for example, laryngeal papilloma, vocal cord paralysis, and subglottic stenosis, right. Okay, laryngeal papilloma, vocal cord paralysis, and subglottic stenosis. So these are what, biphagic stridor. Talking about expiratory stridor, right, if there is lesion in thoracic trachea, right, and bronchi, right, what bronchi, primary and secondary bronchi, for example bronchial foreign body or tracheal stenosis, if there will be obstruction in this region, then we call it expiratory stridor. Okay, we talked about what inspiratory, if there is what obstruction or lesion within what our supraglottic or pharynx, right? And talking about biphasic, if there is lesion within glottic, subglottic and cervical trachea. And talking about expiratory stridor, if there will be lesion within what our thoracic trachea or primary or secondary bronchi. So these are the types, right? Okay, these are the types. Now talking about the different causes of stridor. Okay, stridor, the different causes of stridor, it can be what? It can be our congenital and acquired. Talking about congenital and acquired, talking about congenital, this can be what? This can be laryngeal malacia, laryngeal wave, subglottic stenosis, hemangioma, right? Vocal cord paralysis, tongue and jaw abnormalities. So these are the points that need to be enlisted. So what were they? Tongue and jaw abnormality, vocal cord paralysis, hemangioma, subglottic stenosis, laryngeal wave, and laryngomalacia. And talking about the acquired one, what can be the acquired one? One can be a febrile and another can be febrile. And a febrile, fever, that means fever. It is what? It is a sign of what? Our symptom of inflammation. So the every inflammatory conditions in febrile, such as epiglottic, acute laryngitis, laryngotracheitis, diphtheria, retropharyngeal abscess, infectious mononucleosis, and peritonsillar abscess. So what are these? These are the febrile condition, right? The epiglottic, acute laryngitis, laryngotracheitis, diphtheria, pseudo-pharyngeal abscess, infectious mononucleosis, and peritonsillar abscess. So these are the febrile condition, febrile acquired condition. Or febrile are our what? Papillomatous injury, foreign body, laryngeal edema, and adenotonsillar hypertrophy. These are the acquired one. The adenotonsillar hypertrophy, laryngeal edema, foreign body injury, and papillomatosis. So these are what? These are the different etiology of stridor. So talking okay. Okay, now another question, right? We need to talk in larynx topic is about the foreign body